Hi, I'm Dr. Rob Waddell. You might have heard about PCNE, or Primary Care Network Evolution, and you might be wondering, what is it? Well, PCNE is the evolutionary step in a series of stages, all designed toward creating a strong primary care system. It all started with the introduction of the Primary Care Network, or PCN. As you may remember, PCNs were set up to achieve a few things: improving access, coordinating care, focusing on health promotion and chronic diseases, all of which delivered within a team-based approach. The initial work we did was under the PCI. We started to realize we could be doing more, and the birth of PCN 2.0 came out just before Alberta's primary healthcare strategy. Now here we are at PCN Evolution. Wait a minute, what is PCNE? Let's get back to what it is. Explaining an idea works best by painting a mental picture. Let's start with what we want in our clinics. Close your eyes and imagine a world where patients can ask questions in a number of ways and you have time to answer them. You have a team to help you with the most difficult problems patients face. You do today's work today. You can anticipate and plan for your patient's future health needs by actively analyzing your patient population, otherwise known as your panel. You have information about your practice, patients, and outcomes. You can plan for the future. You are leaving on time and spending time with your family and have a high degree of satisfaction with your job. You are able to ask questions, find answers, and make improvements, all supported by your systems. You are always getting better at your work. Continuity, comprehensive care. Imagine where your patients are happy with the service they get, your patients are healthier, and your team is happy with the work they provide. I know what you're thinking. Is this possible? Well, yes. Interested yet? So how do we get there? Let's go back to PCNE. PCNE is the plan for implementing the patient's medical home or health home, either or. We aren't too fussy on what it's called. It's the concepts that matter. Patients will have a health home where they are linked to a specific healthcare provider within a team or a team of providers focused on his or her specific health concerns. Care coordinated with other parts of the health system, such as specialists and home care. Effective connections with social services and supports when needed. This sounds great for patients, but what about you? Your medical or health home is how you relate to your patients, your team, and your practice. But here are the real benefits. Like most doctors, when I hear something I like, I want evidence to back it up. Putting in a medical or health home means that your practice focuses on your patients. This really makes a difference. People who have a doctor and get in to see their doctor report being in better health. Better access to primary care results in improvements in population health outcomes such as mortality and birth weights. When a patient is operating as a health home, other things happen elsewhere. Emergency room use decreases, there are fewer hospitalizations for things that could have been avoided, and even the use of diagnostic tests go down. This journey isn't linear. Evolution is not linear. Every clinic and practice is different. Find a method that works for you. Think of it like building a house. Not every house is the same and might be built differently than others depending on the needs of the family. Every house needs a designer or an architect to help envision how it could be. This designer will create blueprints or a plan to help those doing the work know how to get it done. You can't build a house by yourself. It will be a team of people with different skills and expertise. Care has to be taken to measure each cut and to refer back to the plan and the team to make sure you're all doing what you're supposed to. In the end, you can see the results of your work and feel pride in it. Want to build your home? Here's your next step. If you want to learn more, the Health Home Readiness Tool will help you reflect on your needs. Find out what you need in your home, what you already have, and what you need to renovate. And it all starts with panel, the foundation of your home. you need a good base to build it on. The rest of the home will be built on your panel, your patients. Once you know who all your patients are, you can start to get some interesting information. How many diabetics do you have? How many complex patients? How many women of childbearing age? All of this information will help you determine what is needed in the rest of your home. The main idea here is that you should know your home is built to support your own patient population. Many worry about things like, did I make avoidable mistakes because I was rushed or didn't have the right care team? Did some of my patients seek care elsewhere today when my team would have served them best? Did I miss a patient at risk because I didn't have a system of care to identify and manage them? If you've ever felt this way, PCNE can help. You want to improve patient and provider satisfaction. You will have the support to help you. Panel data will generate better outcomes, greater peace of mind. Your team will help with everything you need. Feel assured that your care is the best. You don't have to worry because it's not just you anymore. You're not alone, and we're here to help. This is PCNE.